Hello, my name is Caroline Ryan, and I am the Care Transitions Lead for the Administration for Community Living. The following interview is an excerpt from a recent ACL Care Transitions Peer Hour. Each Peer Hour features an interview with representatives from care transition programs in the field. These interviews focus on strategies that your colleagues are using to successfully build and strengthen transition programs, as well as adapt them during the COVID-19 pandemic to continue to meet increased needs. The goal is to share actionable information and ideas that you can bring back to your own organization. If you have any care transition questions or would like to share your organization's innovation experience, please feel free to contact the ACL Care Transitions mailbox at caretransitions@acl.hhs.gov. That's caretransitions@acl.hhs.gov.
Very important subject that we're covering today. We have some great panelists all from Georgia, two from AAAs, one from a Center for Independent Living. They represent people and work with people both in rural and urban areas. And then I'm going to introduce them in just a minute. Follow up on what Caroline was saying. You know, COVID has brought many challenges to the work that we do, but hopeful also some opportunities to better support individuals in community settings. Today's focus is really both on transitions that many associate with money follows a person, as Caroline said, longer stays, but also focusing on supporting individuals to exit facilities after a short rehab stay and receive services in their homes and communities where they want to be. This is especially true during this time when people do not want to be entering nursing homes, so we have to be able to be there to help them make that transition. I want to point out as we go through today that Georgia has a state-funded program to target people and to help people transition out of institutions who are there fewer than 90 days. They wouldn't qualify for money follows a person either because of lack of Medicaid status or because they haven't been in the institution that long. So we're focusing on, we're especially excited to hear from Georgia today about that opportunity that they have in addition to what they do with other institutional transitions. So without any more talking by me, let me introduce our panelists for today. From the Walton Options for Independent Living, Beth Miller is here. She's a program director for Home and Community-Based Services, and she leads the Walton Options transition team. She's a certified options counselor and a licensed social worker. Thanks for being with us, Beth. And Tiffany Clifford, who's the executive director of Walton Options, a center that serves 16 counties in Georgia and 12 counties in South Carolina. How about that? Across the border, Tiffany. Well, Walton Options. Good work. We have Denise Baker from the Northwest Georgia AAA. She is the Money Follows a Person and Nursing Home Transition Coordinator for the Northwest Georgia AAA. She's a certified options counselor and licensed social worker. And they needed a team from this Atlanta Regional Commission here. Andrew, that's a joke. So Andrew Parker is the Medicaid Waiver and Community Transition Services Manager at the Atlanta Regional Commission. I've gotten to know Andrew over the last week or so. He's a great person, and he's got some great staff there to support him in this discussion today. Sandra Curtin, Sandra, is Transition Coordinator with the Money Follows a Person program. She has worked in this capacity for 8 years already. And last but not least, Erin Hill-Atkinson, who's a licensed clinical social worker with the Money Follows a Person program for the Atlanta Regional Commission. So welcome all the panelists. We're so excited to hear from you today. So let me start off, if I could. You know, we got so many things that people have written in about. One of the things I want to say thank you to people who took the time to enter into the registration, what they were interested in, because we adjusted the questions that we were going to ask based on what your feedback was. How novel is that? Isn't that great? So let me ask, I guess, and let me start off by asking, let me start with Walton, since they were listed on the top. Your physical access to the facilities, I assume, has either been cut or extremely limited. How have you identified individuals who want to move back to the community? Beth or Tiffany, you want to take that one?
Okay. Basically, we're still receiving referrals from the social workers. We are getting more calls now from family members than we have before. And many of the calls we're getting, the family members are having second thoughts about the nursing home, or due to COVID, they're concerned about their family member and they want to see what services there are to help them take them home. So we have reduced communication. It is more difficult getting to the people, and it's a little bit harder to really feel like you're getting a good assessment when you're just talking over the phone and not able to see the person in person and talk with them there. But the referrals are still coming in, and they're definitely not slowing down. If anything, they're increasing.
All right. Well, more work for us. So,
right.
So Denise, let me ask you about Northwest Georgia. Have you been able to have you seen an increase? How has it been referrals?
Yeah, as far as referrals, sometimes early on, I think that the social workers were under a lot of stress and they kind of forgot about us. And then our options counselor left us, so then I kind of took over that hat. And when I started reaching out to them, they're like, oh, yeah, we remember you. So then they started, sending out more referrals. And then when we were training our new options counselor, he's getting a lot of referrals now just because he's reaching out and saying, hey, I'm the new guy on the block and send me all, you know, whoever wants to go home. So it's picking up again. At first it wasn't, I think, just because the social workers were stressed to the max, just trying to figure it out. So it's getting better.
So both of you said that the facilities really have been making those referrals after, you know, sort of the amazing impact of COVID and having to deal with everything. The communication, the referrals directly from the nursing homes have been coming in, and in some cases coming in more. Andrew and the Regional Commission, the big city, what have you been finding?
We have found that maybe initially things didn't quite pick up. They were pretty much the same, but as that time from March moved forward, we started to see an increase in referrals. Family members were concerned about not being able to see their loved ones. There was word of mouth. Social workers really were seeing that families were seeking to move their loved one back in the community, and that we could really help with that. And then our options counseling staff have all cultivated really good relationships with the staff at the nursing homes, and they did say that that staff is wearing thin and they're having to wear many hats, but it was really about their collaboration that they could continue to get those referrals, because typically when they're in the facility and they're folks are seeing them going about and sharing information, that flow was coming in that area, but now it's really shifted from family members and consumers and social services staff really wanting us to help facilitate getting folks back in the community.
And I heard some talk about family. Have family been stepping up more and wanting people who are institutionalized to be able to move back home during this time? Is that, I know housing is always a challenge, and we're going to talk a little bit about that later, but have there been more family members who may have been reluctant in the past to have a loved one come home that really want their loved one to come home? Any experience with that? Let me start with Atlanta. Aaron?
Aaron's muted, so.
Come on, Aaron.
Anyway, it looks like she's unmuting. Go ahead, Aaron.
You got to unmute it, Aaron. There you go.
Am I unmuted?
Yep, you're good.
Oh, I'm so sorry.
Okay.
Okay. And I do a lot of these meetings too, so I'm not sure why I had my glasses off. But yeah, so it was slow in the very beginning, and then it sort of ramped up with family members and clients, I think, just out of the fear and the number of COVID cases in nursing homes was really scaring the clients there and family members, where they would get panicked and really wanting to kind of move quickly forward on transitions. So we really, Sandra and I both really saw a lot of that, and a few times, leaving without following the process, and then we're trying to figure out if we could help still and under the circumstances. But definitely family members and clients are going to the social workers more, I think, and asking. And so definitely see a lot of, of that now, but the housing is a big issue. I know we're going to talk about that later, but I also see a lot of clients without housing that are coming forward on their own without family and really reaching out a lot to try to move out.
Yeah, well, we are going to get to that biggest issue, but I'd like to, and thanks, Aaron, for that. I love to hear about the state-funded program. Lots of people are interested in saying, okay, Money Follows a Person is great for what it is, but people have to be in there 90 days. They have to be Medicaid eligible for us to be able to work with them. So I'm really, really interested for you to talk about how this program came about in Georgia. And I got a feeling that had a little bit to do with advocacy. So let me start. Tiffany, do you have knowledge of that, or do you want to pass the ball from the Walton Center for Independent Living, how that program came about?
Yeah, I'd be happy to talk about that some. As a SIL director, and as I understand we have a lot of SILs on the call this afternoon, one of the things that we often learn is that we do a lot of things from a grassroots level, and trying to make things happen with consumers because we often lack resources. And what we know more than anything when it comes to nursing home transition is how important it is to have dollars behind that ability to do so, because consumers need so much when they're transitioning back out to help stabilize them back into a community living situation, even with family. And of course, MFP came along and helped with a great deal of those supports. But in Georgia, we also recognized as we were spending MFP dollars that lots of times we were finding folks that did not need the same level of MFP supports. They just needed something to kind of carry them sometimes in that short span of rehab, whereas family was still engaged, visiting, dealing with the placement in that center before the whole economic collapse within their life. They still had a place that they were renting, they still had utilities on, they may just needed something basic like a ramp to be able to go back home, or basic supports once they transitioned from the rehab center. So through the AAAs, Department of Aging Services, and the SILs, there was advocacy work that was done to discuss this funding flow that was created for folks that we would have liked it to have occurred for folks that were still younger, but folks that were 55 and older who would not necessarily qualify for MFP could be in that shorter range of stay, to get them back home through less expensive means, while those circles of supports were still present and family still was motivated to make that happen.
Terrific.
So,
Absolutely terrific. Denise, any experience with that, with the evolution of the state program?
I know that our AAA directors and some of the other staff participated in a lot of the meetings and advocacy part. I did not. I did let them know that, you know, there are some gaps, because you would notice the people that weren't able to qualify for Medicaid or didn't particularly need the actual waiver services, they just needed those barriers removed, and we weren't able to do it with Money Follows the Person. And it is kind of disappointing when you can't help someone when it's just something as simple as a ramp. So yes, we did. I did tell them a lot about what we were seeing that we couldn't help with, and they would carry that on to the state level. So they were helping a lot with that too.
Yeah, fabulous. Anything to add from the big city, Andrew, or any of either Erin or Sandra about the evolution of the state program or how it's working?
I think they did a wonderful job of articulating all of that. I was on that group, and it was really seeking to find ways to address some of the gaps that were not filled by the Money Follows the Person program. In our region, our options counselors really go out and first do some person-centered counseling. And they typically may do that when someone's still in the rehab place. And that really helps them with the individual determine, well, what could we provide to you through this program that might be able to, as these folks have said, you know, keep you in your home, maybe put in something for accessibility or to help your caregiver support, but let's provide an intervention before you lose all of those things that make it challenging to transition back out. So I think by, you know, really reaching folks at that critical juncture, it can really prevent some of that long-term institutionalization.
Great, great. Let me ask if I could, and Sandra, we haven't heard from you yet, so I'm gonna you'll come on the screen for us and talk a little bit about housing. You know, any of us who have worked in institutional transition know that the biggest barrier really to returning home after an institutional stay is somebody who has lost their housing. So Sandra, I don't see your beautiful face, but are you on, and can you tell us about housing challenges, at least from the city perspective?
Oh, she's...
Got to unmute. There you go. Good.
Oh.
Thanks, Sandra.
Oh, all right. Yes, I'm here. For the Money Follows the Person program, MFP, we transition clients to 3 destinations, either home with family, a personal care home, or their own apartment. And of course, home with family has been, we see a lot of that now with family members wanting to get their loved ones out of the nursing home, especially with COVID, with the COVID scare and all. But with finding their own apartments, we do find that that's a little difficult these days. Clients are not able to leave the nursing home to go search for apartments if they get vouchers or things like that, and they can't leave to go search, and very, very little can be done on the phone or over online. So apartment finding has been kind of difficult for clients during this time.
Yeah. Not surprised. No big Section 8 vouchers coming out of the sky for you?
We do have a few, and for the clients that get those, they too have a little bit more difficulty in finding a landlord that has vacancies, number one, and secondly, the same difficulty in getting out to look exists for them too.
Yeah, I understand it. Thanks so much. Great answer. I appreciate it. So how about in the rural area? Denise, anything going on with specialty housing or?
I found that a lot of times some of the apartment managers, I have a few of them that I've built a relationship over the years with, and they will notify me, and they have been great during the COVID. They know that the clients cannot get out of the nursing home to come and sign a lease, and they will actually go to the nursing home and take it with like sticky notes and everything. This is how you do it, and then they'll get on the phone with the client and the social worker, complete that so it gets all signed and initialed and everything correctly, and then the social worker takes it back out to them and they can go ahead and process it then when they're signing the lease. So we've had a lot of success with those properties that are willing to do that. As far as the residents getting out to look for their own apartments, it's pretty much impossible, because if they leave the building for any reason, including a medical appointment, they're on a 2-week quarantine by themselves regardless.
Right.
So it's been working really well with some of our apartments that will go and do that for us. So that's been helpful.
I think that is great. I love hearing that story, but let's just go to Walton and see if Beth or Tiffany have anything to add from your rural area of Georgia on housing.
I'll let Beth speak in a minute, but I can speak in saying that some of the CILs have been able to develop memorandums of understanding with like local housing and housing authorities and HUD for so many spaces that may open up. And then additionally for us, we actually had to make the decision to commit dollars to staffing for a person that pretty much spends full time researching, looking for ads, housing, and trying to develop relationships with folks that are providing that to open windows of opportunity for our consumers that are transitioning.
Right. Anything else? Thanks, Tiffany. Beth, anything to add to that on housing? All right. Are you on mute, Beth? Yeah, I know.
Oh, did that unmute me?
Now you're done. Yep, you did it.
Yay. I did just want to mention and add to what Denise said, in that the other problem that we run into is that HUD is behind the ball on current market housing requirements, so that even if we can get a voucher for a consumer to find a apartment that is appropriate for that individual at that price is almost impossible as well. Mm-hmm. So even talking about it, the market has now outpriced by a good deal most of what HUD is willing to cover.
Yeah. So that's a constant, but obviously bad during this time. We're really trying. People want to get out, and we're really trying to get people out. We're coming close to our time. I'm surprised that nobody jumped in and said, "Okay, Roger, time." So what I really wanted to ask is, there are a number of people who've said, "Wow, I just love the fact that your Centers for Independent Living and your area agencies on aging are working together, and you both have a common mission in institutional transition." So how did this happen, and how do you continue to work together? Because we know, people like Andrew at the Regional Commission is always trying to sort of shove everybody aside and get all the work. I'm glad you're laughing. Good. So You wanna take that one, Tiffany, from your perspective first, from the Walton Center?
Sure. So as Walton Options, we've been very fortunate for a very long time to have a positive relationship with our regional area agency on aging, and I just have to credit that to the leadership there of Ms. Cummings, Jeanette Cummings, because she always worked from a philosophy that if SILs were already doing the work, then if money came to pay for those services, that it should funnel to the SILs because the work is already happening and it's what we're charged to do. So early on when transition became part of a funding platform, those discussions happen. And then I think it just happened, you know, to progress, to build the relationships with certain, again, leadership at the state level and Department of Aging Services that saw us as partners with the same goal, working towards transitions or services for aging adults with disabilities. And that's come from not just MFP, but our home modifications program, our equipment distribution program, some of our eyeglass programs. So whenever the AAA locally saw an opportunity and then at the state level saw an opportunity to include SILs as part of accomplishing their mission, you know, we've been brought to the table. So it's just a matter of those relationships that have developed, and we the validity for what each does.
Great, thanks so much, Tiffany. I love it. So is it a lot different? I mean, rural areas, generally people are better at working together than in the big sharp elbows of the city, Andrew. What do you got to say in Atlanta? Is the regional commission working with the centers?
You know, I think that's one of the great things about the transition from the AAA network into working into ADRC and No Wrong Door. You know, there's so much value in the SILs with the work that they do in other areas and have been doing for a long time. So, you know, the different types of supports, travel training, peer support, you know, they are able to bring something to the table that, you know, we as social services professionals may not. And so we've learned so much from our collaboration with them. And I've really looked at the services that they provide. We have a population in the metro area where we're, you know, transitioning a large number of people that are not older adults. So it's been really valuable for us to have this relationship and to work closely to really provide a holistic approach to, you know, populations that want to move into the community.
Excellent, excellent. Thank you, Andrew. Okay, you may get the last word, Denise. How's your relationship? Are you working
with our SIL? We have, honestly, I've been doing this for 8 or 9 years now and started as an options counselor, and the SILs were part of our program even before it changed a little bit to where they actually took over and did some transition coordinating too under the Money Follows the Person program. So had meetings with them for years, and we appreciate what they do too. So they're very helpful to us.
I love this. We're going to just bottle this up and ship it all over the country.
Thank you so much for listening today. We appreciate your time. We also want to thank our speakers for sharing their experiences with all of their peers on this Care Transitions Peer Hour. If you have any questions or would like any direct support from our technical assistance team, please reach out to the ACL Care Transitions email at caretransitions@acl.hhs.gov. Thank you.